Republicans are forcing this conversation in uncomfortable ways, then I will meet them to it. I have an IUD. I've had one for years. Now, IUDs, if an IUD fails and results in an ectopic pregnancy, which has about a 50% chance, I believe, of an ectopic pregnancy emerging with an IUD, would that mean that if I were hospitalized in these states, you would have to wait until I was in the process, potentially, of actively dying before you could effectively treat me and save my or anyone in our position's life?
So thank you for that question. I think this came up earlier around ectopic pregnancies. To date, and to my knowledge, there are no laws that outlaw care for ectopic pregnancies. However, what we've seen in Texas, because these laws are written by politicians and sometimes don't make sense and are difficult to grapple with and understand by physicians who are practicing medicine, we have seen people denied access to that care. And I've actually seen somebody in Texas who left the state to get care for her ectopic pregnancies. So it's very possible. It depends on which healthcare provider you see, which clinic or hospital you may go to, because we're interpreting these laws in real time by physicians.
And that's exactly the problem, right? Is that doctors
time
are now
has
having
expired.
to interpret law.
Does not deserve access to abortion. You are saying, unless you correct me and tell me what you believe a woman deserves to have when she has been raped, the victim of incest, or is in the middle of a dangerous miscarriage, if you can't state it, then be clear you believe in no exceptions for women. A cold, heartless, violent approach to women's health. You want to ban all abortions. That is your goal. Many of you have been open about that. And if you flip the House, we know that you will put forward a full ban on all abortion for all states. You've been clear about it. You want to turn a veterans bill into an abortion bill. Let's do it. Not one of you are a medical doctor. Not one of you. What the VA guidelines say is that if you've been raped or the victim of incest or a medical professional deems that your pregnancy is a risk to your health, the one of 4 women in this country who has had a miscarriage, probably many women in this room, that you are a better judge of who gets to decide the future of their life and not a medical doctor? Who do you think you are? You are politicians. We are all on this floor elected officials and not medical professionals. If it was your wife, your daughter, who is suffering through a miscarriage, are you going to tell her she can't until her fever gets high enough, until she's bleeding harder? That's what's happening in the state of Texas right now. If that's what you want for veterans, shame on you.